I am Dr. Chandrasekhara, rheumatologist. Want to discuss in brief about the perspective of a little rare disease, but not an uncommon disease called scleroderma. Scleroderma is a type of autoimmune disease, which occurs, I can say, by chance, because it's very difficult for anyone to say why an individual will develop this autoimmune disease. Some think it is hereditary, but in a true sense it is not. It is not a hereditary disease. Some amount of genetic contribution could be there, but they are not the dominant role. Actually, we talk these kind of diseases as polygenic disease. What we meant here is different causes, different environmental factors, including the interaction between the genes and environment, is expected to trigger this type of autoimmune disease called scleroderma. In scleroderma, we consider as a relatively less common disease because it is supposed to happen 1 out of 50,000 to 1 lakh population. So you can really imagine the rarity of the disease. The disease starts as a result of your immune system start falsely recognizing your own protein as something from outside. What we mean is normally immune system is expected not to react on your own protein. I mean, it's like your army, your policemen should not unnecessarily attack you or try to kill or damage our own properties. It is prepared, for instance, we have an army. If an external invader walks in and instead of that, if the army man starts fighting against yourself or on your own properties, then the trouble is much more. This is what happens in autoimmune disease. Immune system, for a reason which we are unable to completely determine, sometimes starts attacking our own self proteins, as a result of which it generates something what is called as inflammation, as if these tissues to which they target have been infected, damaged, or something of that sort has happened. And they continuously produce inflammation and starts damaging the tissue. Based on the antibodies they produce, say for example, in scleroderma, we have anti-SCL70, anti-topoisomerase. We also have anti-centromere B or A proteins. And like that, the antibodies, that immune system is targeted against these proteins. Depending on the protein it targets, depending upon the antibodies, what we call autoantibodies generated, we have different clinical problems. If SCL70 or few of these are present, usually skin becomes thicker because the skin has a lot of inflammation, as a result of which slowly skin becomes thick and fibrous. Similarly, same problem can happen under the mucosal membrane in the esophagus, can happen in the gastrointestinal system, it can happen in the lungs, what we call as interstitial fibrosis, and many of the tissues may become thick. As a consequence of which it damages the normal functioning of these parts. So this is one of the very disfiguring disease because skin on the face becomes thick and also becomes gradually over a period of time becomes thinner. That really produces a sort of shrunken face, difficulty to open the mouth, and so on and so forth. Disease, unless it is affecting the internal organs like lungs or heart or kidneys usually do not produce an immediate threat to life. But gradually over a period of time, when the functioning of the lungs and the functioning of the gastrointestinal systems starts getting damaged, usually things can go wrong. So now, is there a way out for this kind of disease? Certainly yes. Earlier days, treating this disease was little difficult. We were really confused what is the best way to treat and what is the best way to manage that. And also the availability of tests, availability of the diagnostic criteria were limited. As a result, many of these problems like scleroderma would have gone unrecognized, especially in the early course of the disease. Now we are able to pick the disease very early. So if we intervene with a good immunomodulators, it can definitely reduce the speed in which the disease progresses. What I say is skin becoming bad in 2-3 years can be stretched to 10 to 20 years. Lungs getting damaged down in 3-4 years can be stretched to 15 to 20 years. I mean, that really gives a long life and a good quality of life, because lung with the treatment remains in a good shape. So you need not walk into the oxygen dependent. So early recognition, early identification, early treatment with good immunomodulators is going to take the individual long way. Why early is required? What is this early treatment? Why can't you give it when the disease is well established or about to cause damage or causing the damage? See, it's a simple analogy what I always tell. Autoimmune disease like as if the body has caught on fire. Unfortunately, the fire is created by the body itself. That's why we call it autoimmune disease. In any fire, longer the time you leave, fire becomes more established and also damages lot of organs, lot of parts of the house. So also in the autoimmune disease, longer you leave, it causes permanent damage. So as we know, a damaged organ only need to be transplanted, but you cannot save it back. Some of the organs like lungs, thinning of the skin, damages to the kidneys, these are not reversible. So as a result of which, if you don't pick the problem early and treat the problem early, you will end up in damaging a lot of organs. Secondly, immune system is something which matures over time. You might have seen in the COVID time, we always say that first injection to be followed by a second injection, and if required, after every year, we need to give a booster dose. Why do I need it? We need it because as we give a second injection, the immune response becomes much more better than what we give in first injection. If I give booster dose, immune response is maintained and sustained. So similarly, as the longer the time you leave, since the proteins are self and it is continuously exposed, likely that the disease become more and more robust and more resistant to treatment. So early intervention, early detection, early treatment with the modern medical care is going to definitely take a long way. Few of the things what I have seen in my last 10-15 years is quite often patients feels frustrated about the long-term treatment. I mean, let's be very clear. When you have a problem, the solution to a problem is finding a solution rather than running around and not accepting the problem and trying to figure out something which is falsely assured. I mean, those kind of things should be very skillfully avoided. So you should be very clear what is the best way treating, what are the best evaluated treatments which will help you. And once you are sure, if you walk in that line, you can definitely find a solution to the problems. Lots of research work is going on. Hopefully, we should be able to crack this autoimmune disease, the real way how to handle that. But till such time, we need to take a proper treatment and try to maintain the things. So the message I would like to pass it across to the patients of scleroderma as well as other autoimmune diseases. Accept the problem, try to work towards solution, and that is the best way to solve it. And hopefully, if you really get into the right slot of treatment in the early course, you can really do well. Thank you.